Cabinet has agreed that all of New Zealand beyond the boundaries to the north and south of Auckland will move to level 2 at 11:59 p.m. tomorrow, Tuesday, the 7th of September. Schools and other education providers will be given the next 48 hours to prepare to reopen from Thursday morning. Auckland is set to stay at level 4 until 11:59 p.m. next Tuesday, September 14. As we have today, Cabinet will review the levels for the whole country, including Auckland, at a Cabinet meeting next Monday, 13 September, and announce any changes that same day. These changes mean we'll have one part of the country at level 4 and the rest at level 2. For the most part, that is workable with the hard boundaries we've set up, but it does pose challenges, particularly for Northland, who essentially become cut off from the rest of the country. I want to assure Northland that we are working through those issues. There will be the ability for people to travel through Auckland if someone in Northland, for instance, needs to get to the Waikato for their work. People will need to travel directly without stopping while going through Auckland. You'll also need to carry evidence of the purpose of travel and the location where you are travelling to. The ability to keep moving down levels across so much of New Zealand is testament to everybody's hard work, but it doesn't mean we're out of the woods. To account for Delta, level 2 will be different to how it's been before. This is Delta level 2. Face coverings are now mandatory at alert level 2 whenever you're inside most public venues. So if you're entering a retail shop or an indoor facility like a mall or a library, you must wear a mask. However, of course, you can take your mask off in hospitality venues like restaurants, bars and cafes so that, of course, you can eat and drink. Staff at these venues, though, and at any other public-facing businesses open at level 2 must wear face coverings as well. But to keep it really simple, if you're out and about and visiting indoor venues, please wear a mask. We've learnt the hard way that Delta is at least twice as transmissible as previous strains of the virus and that it travels essentially through the air rather than via droplets or contact. That is why wearing masks is so important and our new normal at level 2. We want people scanning everywhere they go, but there are some places this isn't just an ask, it's now a rule. This includes bars, restaurants, cinemas, nightclubs, concerts, churches and close contact businesses like hairdressers. That's where you either have to scan or there has to be record keeping. Essentially places where there is close contact between people, where it's harder to wear a mask and where the virus can easily spread. It also means that if you're at places like private events, there must be a record kept of people attending. But even in places you are not legally required to scan in, my advice is, of course, do it anyway. Because Delta is more transmissible, we're much more worried about big groups of people. It's now no longer just whether you have enough space between you and others, but rather if you have too many people in a shared space generally with poor ventilation, that really ups the risk. That's why today I'm sharing 2 additional changes to level 2. The first is a limit of 50 people for indoor gatherings, hospitality settings and event venues. This, coupled with the rules around customers being seated and tables being separated, reduces down the risk of super spreader events. If you're an outdoor venue or you have an outdoor space, you can have up to 100 people in that space, keeping in mind again the rules around being seated and separated. That's because ventilation makes such a huge difference to how infectious a COVID case is to others. The second change relates to indoor public facilities like gyms, museums and libraries. Previously, these venues have had no hard limit on how many people are allowed to be in a space, but instead, a 1 metre distancing rule is a proxy for how many people could be inside. We're now bringing these venues into alignment with the rules that exist for retail and supermarkets, which is 2 metres. That again will just mean we have fewer people in a venue, with the number being dependent on the size of that venue. So a quick summary: wear a mask, scan everywhere you go, and be mindful that when you visit some places they will have rules around how many people can be inside at any given time. Be patient, be kind and support local. These are tough times. Moving to level 2 is progress though, and it is positive, but it comes with a warning. We've done so well to get this outbreak under control. Level 4 restrictions are working, but the job is not done. We're within sight of elimination, but we cannot drop the ball. For the full details of the new Level 2 settings, Delta 2, visit covid19.govt.nz. Our case numbers at present are coming down, but we continue to see persistent cases attached to the current outbreak. Some of this is to be expected as we see close contacts and family members test positive, but some of these are still what we call unlinked or mystery cases. These matter because so long as we don't know where a case has come from, we cannot tell if we have other chains of transmission in the community that we haven't isolated yet. That's a cause for concern, and it is why testing is so important to us. And it is why we're asking, if you have any cold or flu-like symptoms, please get a test. It doesn't matter where you are in the country. We need you to be tested. We also want to increase our testing of people who are crossing the Auckland boundaries to ensure we don't see any spread beyond Auckland. To ensure the safety of those in lower alert levels around the country, we want to step that testing up. And that's why, as has been said, all workers who are permitted to cross the Auckland boundary will be required to have evidence of a test taken within the 7 days before crossing. And as has been said, this will be a requirement from 11:59 p.m. on Thursday, leaving time for people to go ahead now and get a test. Because this is surveillance testing, people will not be required to stand down or stay at home while awaiting their result if they are an essential worker. We're also asking those who are permitted to travel for personal reasons to be tested, noting that this travel is often required for urgent reasons and may not always be possible. And of course, everyone's aware of the exemption process they have to go through for that. These are extra ways we can keep up our surveillance and ensure we contain the outbreak and stop it from spreading to other parts of the country. This also gives us extra confidence as we consider changes to alert level settings outside of Auckland.
You may have seen today's numbers already from our 1 p.m. media release. The key figures for me to reiterate today are there are once again 20 new community cases of Covid-19, all are in Auckland, so our total number from this outbreak is now 821. The total number of community cases this morning, as at 9 o'clock yet to be linked, was 33, a small rise on yesterday's numbers, but investigations continue through the day and that number will continue to fall. Our analysis of yesterday's 20 cases that were announced shows 18 of these, or 90%, were contacts of known cases, and of these, 14, or 70%, were household contacts who were already isolating. 5 of the cases overall were infectious in the community in one or other place. All these numbers are moving in the right direction, which is reassuring. Our most important message today is if you have any symptoms, you must get tested wherever you are in New Zealand. At the start of the outbreak, we focused our testing heavily on those who had contact with cases or who had been in locations of interest. We know there are fewer people, as I said, with symptoms, but getting tested if you are symptomatic is still the most important thing. Everything else is supplementary. There will be more regular surveillance testing for healthcare workers who've worked caring for or on wards or units with COVID-19 patients in our hospitals in Auckland. This will involve both immediate testing and ongoing surveillance testing for the next couple of weeks. In addition, we are increasing the frequency of testing of staff who are working in our quarantine facilities in Auckland for the next few weeks. Given the large number of cases in there and what we know about the Delta variant is that people are shedding more virus than they did with earlier variants. So, in our quarantine facilities, we are moving to twice-weekly testing for workers there for at least the next 2 weeks. We will be working closely with employers who have workers who are crossing the Auckland boundary to put in place weekly testing of those workers. This is part of our overall efforts to fully control and end this Delta outbreak over the coming weeks. We have started engaging with employers and industries whose workers are affected. Now, because this is surveillance testing, that is, these people don't have symptoms, they will not be required to stand down or stay at home while awaiting their result, unless, of course, they have symptoms. And likewise, just as for other testing, there will be no cost for this testing. We are still working through the details, but the key point is essential workers crossing the Auckland border will be expected to have had a test in the last 7 days and be able to show proof of this. We're finalising how we will provide people with this proof, and it's likely to be an email or text message that they will be able to show at the boundary. There will be spot checks there to ensure people are getting this weekly testing done. We know there are around 3,000 essential workers who are crossing the alert level boundary each day out of an estimated 220,000 essential workers in Auckland. In the first instance, this testing will be available, of course, as our nasopharyngeal swabbing at any of the community testing centres in Auckland and at general practices and urgent care centres. However, we are also working with the provider in Auckland to enable saliva-based testing to be rolled out and available over coming weeks too, to support that effort. I would like to thank all essential workers for their efforts to keep all New Zealanders safe. These measures will start from Wednesday the 8th of September. Finally, I know we're asking a lot of Aucklanders at the moment, and I recognise that these additional testing requirements might be inconvenient and indeed unwelcome. But I do want to reiterate how important they are, and that the sole purpose is to ensure we stamp out this Delta outbreak and that Auckland can move down alert levels as quickly and as safely as possible. So thank you to everyone for what you've done to date. It is making a difference, and let's see it through.